We will now look at the function of the Risk Clinic. If we click on a test patient here, we will then click on the Risk Clinic button, which brings up us into the Risk Clinic reporting area. As you can see, we have a small nuclear family. For the individual patient, we can add diseases or add genetic testing information. I'll show you how we do that. And over here we can put information specifically about that individual, as well as upload documents relevant to that individual. Now, if we begin with this nuclear family, there are many ways to add a complete family history. This can be done by the patient using a tablet PC or our internet-based data entry system. Or the data can be uploaded into this system from another software package using an HL7 interface. Or we can use the Family History tab, or we can use the what we call our bulk add function. We can say the patient has 2 brothers, has 1 sister, has 1 son, has 2 aunts on the mother's side, has 3 uncles on the mother's side, has 1 aunt on the father's side, and has 3 uncles on the father's side. When we click Add Relatives, you can see that now that family has been fleshed out. And we go back to the pedigree, and then here we see our family with a complete set of pedigree information. We can now go to the patient's sister, and we can add in disease information by saying New Disease, typing in any 2 letters of a disease, which will then bring up the list for that disease. So let's say here breast cancer. And we can put in the age for this patient, let's say 34. We can also come up to the right side panel and say that the sister's name is Mary, and that she is 45 or was 45, and that she is deceased. We will go up to one of the uncles, and for this uncle we can also add disease either by coming back to the disease tab or by right-clicking on the uncle and hitting Add Disease. You can then type in that the uncle had a colon colorectal cancer, and that the uncle was 56 when diagnosed. Hitting the Add button then brings that disease for the uncle. We can say that the mother also had a disease, and let's say that she also had colorectal cancer. And we can say that she was 26 when she had it. We have to hit the Add button to accept that information. We can move on to the father's side of the family, and clicking on a paternal aunt, we can add a new disease here. Type in ovarian cancer, and type in that occurred at age 34. And we can say that the patient was 43 when they died. We can also go on to the paternal grandmother, add a disease, and say the paternal grandmother had ovarian cancer, and she was 63 when she had it. And you can add in as much or as little detail about the family members as you want, but in general you'd want to put in the name and the ages of each individual as you move along.